Hey guys, it's Dr. Jackson from the Sports Pod. Want to come to you today and bring you another quick video. I'd like to talk a little bit about sports hernias. So sports hernias is definitely something that we see a lot in our practice. It's a little bit tricky to diagnose, and so I want to give you a little bit of information on sports hernias and talk to you a little bit about the mechanism of injuries involved, what structures are involved, how to properly diagnose this and kind of where to go at that point. So like I said, sports hernia, what is it? Well, it's actually a misnomer. It's not necessarily what we would consider in the healthcare profession a hernia. So oftentimes a hernia is when you have, maybe your organs are protruding through like a weakened structure, in the abdominal wall. For instance, like an inguinal hernia, you will feel a palpable mass. Now, you don't feel any of that with the sports hernia. So, like I said, that's why it's a little bit of a misnomer. If anything, it's more of a sprain strain type of injury, and it's due to just a muscular imbalance between a few different structures. I'm going to show you here really quickly on this application that I have the structures involved, and then I'll kind of tell you the mechanism of injury and kind of signs and symptoms and how to kind of properly diagnose this and where to go from there. So if you look right here on this application that I've got, you can see that I have a certain muscle group right here that's highlighted. Now this blue structure is actually part of your abdominal muscles. So you've got your obliques, you've got your deeper abdominal muscles, you've got your rectus abdominis muscles, which are those muscles that you see when people have 6-packs or 8-packs, very well defined abdominal muscles, and they actually come down and attach in this area to your pubic bone. Now if I blow this up a little bit, you can also see that there's another set of muscle groups down here called your adductors. Now these are what people consider your groin muscles. So those muscles on the inside of your leg are kind of directly opposite the abdominals on the other side, and they essentially attach to the same area of the body in that pubic bone area. So how do you get a injury to your groin? How do you get a sports hernia? It's usually some sort of forceful twisting and explosive twisting motion, and the muscular imbalance between the abdominal muscles and the groin muscles or adductor muscles causes a slight tearing where they attach onto the pubic bone. So that's why I say it's more of like a sprain strain type injury as opposed to a quote unquote hernia. However, you can repair these very easily through physical therapy. Oftentimes it's just a matter of strengthening those muscles. You can also do certain techniques such as acupuncture, dry needling to go in there and help kind of heal those structures a lot more quickly. But also just strength training, mobility training, that's all going to help as well. So now, how do you know if you have a sports hernia? Well, some of the signs and symptoms would be, pain in the groin area, not only just when you palpate or press down in that area, but when you walk or when you twist a certain way. Also, you may feel like there's an increase in pain when you cough or you sneeze or you bear down. Also, rest alleviates this. So let's say you take some time off, a few days off, you're feeling pretty good, then you get back into the swing of things and it starts bothering you again. So that's usually a good indicator that something more is going on. A great way to kind of assess and see if something is going on, such as a sports hernia, would be to do a sit-up, but not just a regular sit-up, do a resisted sit-up. If you do a resisted sit-up, it adds more stress and strain onto those abdominal muscles, which tug at that pubic bone, and that could definitely increase your pain. That's a good indicator to you if you feel like you have something going on to kind of go and get it checked out. So if you feel like you have a sports hernia or something's going on down in that area, you're not sure what it is, just go ahead, get it checked out. And that way you can kind of know for sure and get on the road to recovery. If not, this is an issue that can linger on for months or even years and become a very chronic issue and keep you from doing a lot of the things that you may love. So once again, my name is Dr. Jackson, work at the Sports Pod. If you have any questions, feel free to comment. Down here in the left-hand corner will be all the social media information. Hope to hear from you soon. Have a good one and move free.